This is Larly with Older and Bolder with Larly. And today I'm going to share in this episode about Medicare. What is the importance of Medicare? Well, for me, I'm going to be turning 65 in the next month. I sound excited, and I am. When I was younger, 65 seemed so far away, but it's here. And I'm so grateful for my life. I'm so grateful. I'm going to take the mystery out of Medicare. And in this episode, I'm going to discuss the Medicare plans. And then in shorter videos, I will break down each part of Medicare. So let's get into today's episode. What I'd like to do is just take you on my journey as I have to select a Medicare plan for 2023. You may be in the same position that I was in. I left a job at the age of 63, and the job did not offer any retiree medical care for myself. So I had to purchase a plan just to bridge me over until I was Medicare eligible. So I'm going to go through some slides. I want to review why do I have to enroll in Medicare. I'm going to review the Medicare plans, premium costs, a quick summary, important questions, items to consider, and then what's next. So you ask, what is Medicare? Well, Medicare is federal health insurance for people 65 or older and others who meet the eligibility criteria. And what does that mean? If you are a person that perhaps you're not working for the state, or you're not working for a government entity, or you're not in the military, as you're working, you have to think about once you retire, how will you have your health insurance covered? What you do not want to do is not have health insurance and pay out of pocket, because medical bankruptcy is high. People have a lot of medical debt due to, and they may have insurance, but just due to the high cost of health care, at least in the United States. So what happens is that we have Medicare. Medicare is really a safety net for those of us that need health insurance when we turn 65. Medicare provides hospital, physician, and outpatient insurance along with prescription drug coverage. I'm researching Medicare plans because I've met the eligibility criteria and I met the guidelines to enroll in Medicare coverage. I'm turning 65 in October. I'm a U.S. citizen, and I currently have private health insurance coverage that will be terminated once I am active on Medicare. Medicare is a benefit, and I've paid into it, and I'm sure you also, if you have been working and taxes have been taken out over the course of my working years, I have paid into Medicare. So it is a benefit. It's not an entitlement program. The way that we pay into Medicare is through payroll taxes, FICA, Federal Insurance Contributions Act. When you're contributing or paying FICA taxes, it helps to fund both Social Security and the Medicare programs, and this money is deducted from our paychecks. Social Security is that government program that we also pay into that assists us when we retire in paying our expenses and our bills. But I'm going to talk about Medicare in this particular video. Medicare plans. Medicare offers Part A and Part B. So if you are a person enrolling in Medicare, because this is a government health insurance, this is what is offered to each person. I'm also going to cover Medicare Part C, but let me concentrate on Part A and Part B. Part A would cover inpatient hospital services, skilled nursing facility, hospice care, labs, tests, surgery, and services associated with inpatient care. and also home health care. Skilled nursing facility, this is not long-term care. If you were to have broken your hip and you had to go to a rehab facility, this would fall under skilled nursing facility, where Medicare would cover it for a certain amount of days. Medicare Part B, the services that fall under that: outpatient services, physician health, provider visits. Many preventive and screening services fall under Medicare Part B, as well as durable medical equipment, and that would be canes, crutches, wheelchair, oxygen supplies, the diabetic strips. So those could fall under DME, durable medical equipment, under Medicare Part B. Or there's Medicare Part C. Let me go back. Medicare Part A and Part B is considered traditional or original Medicare. Medicare Part C is considered an Advantage plan or managed Medicare, and it replaces Part A and B, but it offers the services offered under A and B. So for instance, you could decide on a Medicare Part C plan, and it would have skilled nursing, it would have the parts that fall under Medicare Part A, and it would also have those outpatient services. But what's unique about the Advantage plans, these are offered by private insurance companies. The insurance company manages the care. Under Part C, usually requires referrals to see specialists and requires prior approval. So the insurance company has to approve the services before they can be received. And if you select the Medicare Part C plan, it has a network of healthcare providers and services that you will be directed, or if I select this plan, I will be directed to use. Individuals like Medicare Part C because it offers dental, oftentimes vision, hearing, and gym membership, which does not fall under Medicare Part A and B, the traditional Medicare. Medicare premium costs. Medicare Part A, that inpatient, skilled nursing because you're in there for a short time, hospice care. Medicare Part A, usually for an individual, does not have a monthly premium. Why? Because those of us who have paid Medicare taxes long enough while working, it's usually 10 years, we qualify and will not have to pay a premium. And that's good news. Medicare Part B. For 2023, the monthly premium is $164.90. This amount could be different depending on the income that you had. So I'm going to stick with myself. I'll be paying a premium of $164.90. And I'm also going to review in a couple other videos the cost of these services. For Medicare Part C, again, offered by private insurance companies, they manage the care. Usually what makes these type of plans attractive is that there's no premium cost. However, even when selecting a Medicare Advantage plan, we would still have to cover the Part B monthly premium of $164.90. Medicare Advantage, again, it's managed care. Many of these plans, Part C, they're attractive because you do not have to pay a premium on top of what you have to pay under Medicare Part B. So in other words, in order to have Medicare Part C, a person would enroll in Medicare Part A and Part B, and then they would be eligible to enroll in Medicare Part C. Again, Medicare Part C would offer those services that are offered under original Medicare, the inpatient, skilled nursing, hospice care, and also those services that fall under Part B. Just a quick summary: Medicare Part A and Medicare Part B are referred to as original Medicare or traditional Medicare. So in my case, I have to make a decision. Am I going to go with original Medicare Part A and B? Or I can make a decision that I want Medicare Part C, meaning that I enroll in a managed Medicare plan. Again, I'm keeping in mind managed Medicare, managed by the insurance company, requires referrals and also requires prior authorization for many services. Medicare Part D, that's a prescription drug plan. I'm going to discuss that in another video. My questions: how do I sign up for Medicare? What about Medicare Part D? Is there any out-of-pocket limit on what I'm paying out for Medicare? What if I don't sign up now for Parts A and Part B? How do I sign up for Medicare? I know that I sign up through the Social Security Administration. I'm going to use their website. I'm not signing up for Social Security, but it is a way I'm going to sign up for Medicare Part A and Part B. Medicare Part D, I'm going to go online and see what plans are offered for prescription drugs. I'm keeping in mind that for the future, yes, I may not have any health concerns now, but insurance, I believe, is to help mitigate risk if something happens. Is there an out-of-pocket limit on what I'm paying out for Medicare? I'm going to review that in another video. There are costs associated with receiving services under Medicare, in addition to Part B premium. What if I don't sign up now for Parts A and B? Medicare has very strict criteria. So if you're a person getting close to 65, you should take a look at the Medicare.gov website, or you can also check with your Human Resources Department if you have one. The reason I'm pointing out there are some penalties for not signing up for Medicare when you become eligible. Now, there are some people who are turning 65, working for a company that requires medical health care. Those individuals may be able to delay Medicare. It is important that you check it out if you're getting close to 65 to know when you should sign up and if you're eligible. There's other individuals who are turning 65 but perhaps work for a small company. You'll have to investigate and see, because Medicare has strict rules for when they pay and how they should pay for medical claims. So it's just important you know when you should sign up. Otherwise, there are some strict penalties associated with not signing up on time. What do I have to consider? I'm in my initial enrollment period, meaning this is a time as a new beneficiary I need to enroll in Medicare. Right now it's September of 2023, so I'm going to be enrolling in Medicare within the next few days. I want to also consider the costs associated with Medicare Part A, B, and I'm also going to look at Managed Medicare Part C, and I'm going to see if those benefits, maybe the gym membership, the vision, if those are attractive to me versus just going with traditional Medicare. And then I'm also going to do a comparison of costs, benefits, and services. So what's next? I'm going to make a couple other videos where I break down the different parts of Medicare so that I can really see what I'm working with and make a wise and informed decision. So thanks again for watching, and this is Older and Bolder with Larly.